Hello everyone, good evening. Good evening all of you. Hope you are doing well. So today I thought okay, let's do live. Thank you Mikhail for your compliment. So guys, are you able to see my screen? Let's wait for some other students like only um a few of students are there. So okay, so this is the first question. First question means it's from the integumentary system. A 13-year-old female is having 15 square centimeter debridement performed on an infected. Okay, Mikhail, right? Mikhail or Michael? Okay, whatever. Anyway, thank you for your compliment. Uh, yeah, a 13-year-old female is having 15 square centimeter. Michael Jackson. Okay, fine, Michael. Okay, good. Nice name. Uh, yeah, okay. Can I read this question? A 13-year-old female is having 15 square centimeter debridement performed on an infected ulcer with eschar on the right foot. Using sharp dissection, the ulcer was debrided all the way to down the bone of the foot. Using sharp dissection, the ulcer was debrided. The bone had to be minimally trimmed because a sharp point at the end of the metatarsal. After debriding the area, there was minimal bleeding because of very poor circulation of the foot. It seems that the toes next to the ulcer may have some involvement and cultures were taken. The area was dressed with sterile saline and dressing and then wrapped. What CPD code should be reported? Okay, Michael. Okay. Michael Jackson. Okay, fine. Wow, congratulations, Michael, for scoring 90 percentage in the CPC examination. Okay, very good. And all the best for your future, dear. I'm so happy to hear this beautiful news. Okay. Okay, Rakesh already solved the question. 11044. Okay, what about others? Others, please do comment below your answers. And guys, one of my student, she's passed her CPC exam with 79 score. Okay, so I'm so much happy because for getting or for scoring in this 2026, lot of updations are there, but all the students those who are passing, so I'm very happy to be a part because I'm also a part of their journey, so I'm very happy. Okay, okay, most welcome, Michael. Yeah, so 11044 Manikandan and Ragesh Yadav, both of you are correct, guys. Very good. Okay, 11044 is the answer. Thank you so much, Michael. Okay. Okay, and suggest your friends also. Okay, suggest your friends also, dear. Yeah, next one. It's also a long question, but it's an important question, guys, because you can expect these questions like repairs in your examination. Okay, a 64-year-old female who has multiple sclerosis fell from her walker and landed on a glass table. She lacerated her forehead, cheek, and chin, and the total length of this laceration was 6 centimeter. Her right arm and left leg had deep cuts measuring 5 centimeter on each extremity. Her right hand and right foot had a total of 3 centimeter laceration. The ED physician repaired the laceration as follows, like forehead, cheek, chin, hand debridement and cleaning of glass debrides with the laceration being closed with one layer closure, 620 proline switches, The arm and leg were repaired by layered closure, 6 to 0 Vicryl subcutaneous switches, and Prolene switches on the skin. The hand foot were closed with adhesive strip. So select the appropriate procedure codes for this visit. Okay, Rakesh. D. Why are you typing this kind of? Just D is enough for me. Okay. Uh, Here also, your answer is correct. Okay. Because guys, here layered closure. Layered closure means what is layered closure? It means intermediate one. For monthly terminology, anatomy, okay, nice. Thank you. Yeah. So layered closure is mentioned here. Layered means intermediate one. So 12053 is the appropriate code for that. And also based on the anatomical site, you have to take 12034 also 59 separate procedure. I'm not explaining everything. Okay. If you want a detailed class, you can join my 10-day CPC class, guys. Next one. An infant with genu valgum is brought to the operating room to have a bilateral medial distal femoral hemi epiphysiodesis done. On each knee, the C arm was used to localize the growth plate. With the growth plate localizer, an incision was made medially on both sides. So this was taken down to the fascia, which was opened. The peristonium was not opened. The orthofix figure of 8 plate was placed and checked with X-ray. We then irrigated and closed the medial fascia with the cerebrovicral sutures. Skin was closed with the 2 to Vicryl and 3 to monocryl. What is the procedure code is reported? Option D, correct answer, guys. Okay. Ragesh, you are right. And M2, correct answer. Manigandan, correct answer. Okay. Good. Next one. CT scan identified moderate sized right pleural effusion in a 15-year-old male. This was estimated to be 800 cc in size and had an appearance of fluid. On the CT scan, a needle is used to puncture through the chest tissues and enter the pleural cavity to insert a guide wire under ultrasound guidance. A pigtail catheter is then inserted at the length of the guide wire and secured stitches. The catheter will remain in the chest and is connected to drainage systems to drain the accumulated fluid. Okay, Ragesh said option A. What about others? I want to know others options. 32557 CPG code is for percutaneous insertion of an indwelling tunnel pleural catheter with imaging guidance. In this question, is there any ultrasound guidance is mentioned here? Okay, air pleural space is also correct. Yeah, actually, 32557 correct answer. Ragesh, you are right here. Okay, option A is the answer. Next one, guys. Yes, Vinodini Raj and Rakesh, correct answer A. Very good. 49613 is the answer. Good, guys. Yeah, next one. It's actually integumentary system related one question. A 46-year-old female had a previous biopsy that indicated positive malignant margins anteriorly on the right side. Next, a 0.5 centimeter margin was drawn out and a 15 blade scalpel was used for full excision of an 8 centimeter lesion. Layered closure was performed after the removal. The specimen was sent for permanent histopathologic examination. So, what are the CPT code? One one six two six and 12044 modifier 51. Okay, good, correct answer. Actually, Rakesh, I'm giving some time for others also. So that is why I'm not revealing your answer. Okay, I'm giving a little bit time for others also. Want to they also want to check. Okay, that is why. Option C, correct answer. Very good. Because here 11626 for malignant lesion area, malignant lesion here mentions, and about also some next layered closure like intermediate one is also mentioned here. Okay, Vinodini Raji also correct answer here. Very good. Keep going like this. Next, it's a 50K series question. So everyone, please solve this question. Actually, 505 um 543 code is for a laparoscopic partial nephrectomy code. Here, 45-year-old male is going to donate his kidney to his son. Okay. So it's the code 543 option A is for a normal laparoscopic procedure. But here donation is mentioned, right? So Ragesh saying option B, 547. Okay, let me check the code. 50547 is for a surgical laparoscopy involving donor nephrectomy. Yeah, from a living donor to another one. So here also a living donor is there, and the living donor is going to donate his kidney to another person. So that is the condition here actually mentions. And Vinodini is saying option D. Let me check the other code also, 320 CPT code also. It's for a open donor nephrectomy. Procedure performed on living donor, which include kidney for transplantation. Okay, it is also a donor nephrectomy code, right? Here, scope is inserted. Okay. Hmm. Okay. We know the name same saying option B. 50320 is for donor nephrectomy, including cold preservation open from living donor. Open surgery they mention. But here they are not. You actually, what is the procedure here? It's a donation, donating a kidney from the living donor to another person. Here also scope was inserted, right? So you can take the code option B. B is the answer. Okay, Ragesh, you are right. Option B is the answer 50547. Next one. Ragesh and Vinodini also correct answers. Okay. Question. Rag is saying 54163 and Gayatri is saying option C. Okay, let me check the code carefully. Like 54163 code CPD description is for the repair of an incomplete circumcision. Repair of an incomplete circumcision they mentions. Okay, incomplete. So here, 16-year baby or repeat for a repeat circumcision due to redent foreskin. Okay, 560. Okay, what about 564 CPD code? That's for a frenulotomy code of the penis surgical procedure to release frenulum by making small incision. Actually, um, repeat circumcision due to redundant foreskin, that is okay. Anesthetic was injected and an incision was made to the base of the foreskin. Foreskin was pulled back and abscess foreskin taken, and the two foreskin surfaces were sutured together to create circumcision anastosis. Surgery code they mentions, right? 54163 is there and 564 is also there. Here also, foreskin removal is mentioned. In this question, a foreskin was pulled back and excess foreskin was taken off and two row skin surfaces were sutured together. Foreskin switcher is mentioned here. So, uh, 54163 is for a repair of an incomplete circumcision. Okay, it involves the excessive residual foreskin already, I mean, that is mentioned here. And 28 baby, but here baby is 60-day old. 28 days and older, you can take 54163 code here. Here, 16-day of baby is mentioned. Hmm? Actually, the last one, like 54164 is a completely wrong code. Okay. What about 54160? 54160 code. 160 is for a surgical circumcision of neonate 28 days of age or lesser. Um, yeah. So here surgical circumcision is mentioned. Here also the baby is in operating room for a repeat circumcision. Circumcision is mentioned here. So 54160 is the answer. 54160 option B is the answer. Yes, Kanchana, you are right. And also uh, Mandal Arun, you are right. Okay. Second one is the answer 54160. Okay. Next one. Okay, D is the option. Correct answer. Vinodini, correct answer. Kanchana, correct answer. Mm, Mandal Arun, correct answer. Okay, D is the answer, guys. Good. Next one. So, guys, I'm winding up today's session. For this questions are answer, let's discuss in tomorrow's session. Okay. Okay, guys. Bye bye and stay tuned for tomorrow's live